Migraine is a neurological disorder. Look at this picture, shows that severe headache, detail going on. Introduction. Migraine is a common neurological disorder characterized by recurrent, intense headaches that often occur with other symptoms such as nausea, sensitivity to light and sound. It significantly impacts the quality of life and is more prevalent in females than males. A definition. Migraine is a chronic neurological condition defined by moderate to severe headache attacks lasting 4 to 72 hours, often accompanied by associated symptoms like nausea, photophobia, light sensitivity, and phonophobia, sound sensitivity. Types. 1. Migraine without aura. Common type. No warning signs before the headache. To migraine with aura. Sensory disturbances, flashing lights, zing-zong lines, or tingling sensations precede the headache. 3. Chronic migraine. Headaches occur 15 or more days a month for at least 3 months. 4. Hemiplegia migraine. Temporary paralysis or weakness one side of body during the aura phase. 5. Vestibular migraine, characterized by vertigo and dizziness. 6. Ocular migraine. Vascular disturbances occur without significant headache. 7. Menstrual migraine occurs in relation to the menstrual cycle. Causes. 1. Genetic predisposition. 2. Hormonal changes, example estrogen, fluctuations. 3. Environmental triggers, example bright light, loud noises. 4. Stress. 5. Sleep disturbances. 6. Dietary factors, alcohol, caffeine, processed foods. 7. Physical exertion. Risk factors. 1. Family history of migraines. 2. Age, common in young to middle-aged adults. 3. Gender, more frequent in females due to hormonal factors. 4. Stress and anxiety. 5. comorbid conditions like depression or epilepsy. Complications: 1. Medication, overuse headache. 2. Chronic migraine development. 3. Increased risk of stroke, especially in those with ARIA. 4. Psychosocial issues such as depression and anxiety. 5. Reduced productivity and quality of life. Pathophysiology. Pathophysiology of migraine, step-by-step process. First step, trigger initiation. 2. Cortical spreading depression, CSD. 3. Trigeminal nerve activation. 4. Neurogenic inflammation. 5. Pain signal transmission. 6. Central sensitization. 7. Vascular changes. 8. Modulation by brainstem nuclei. 9. Symptomatic and parasymptomatic involvement. The autonomic nervous system becomes activated, causing symptoms like nausea, vomiting, and sensitivity to light and sound. The cascade explains the typical migraine symptoms and highlight targets for treatment such as CGRP inhibitors to interrupt this pathway. Signs and symptoms: 1. Headache, throbbing or pulsating pain, often unilateral. Aura, visual disturbances, flashing blind spot. Sensoria, speech impairments. 3. Nausea and vomiting. 4. Sensitivity to light, photophobia, and sound, phonophobia. 5. Fatigue and irritability. 6. Cognitive difficulties, brain fog. 7. Prodrome symptoms, mood changes. 8. Craving, neck stiffness, hours to days before headache. A diagnosis: 1. Clinical history, detailed headache characteristics, triggers and family history. 2. Physical examination, neurological examination to rule out other conditions. 3. Imaging if needed, MRI to exclude brain abnormalities, CT scan to detect structural issues. 4. National Classification of Headache Disorders criteria. At least 5 attacks with defined features. 5 other tests: electroencephalogram EEG for atypical presentations. Nursing diagnosis: 1. Acute pain related to headache episodes. 2. Ineffective coping related to chronic migraines. 3. Activity intolerance related to severe headache and associated symptoms. 4. Disturbed sensory perception related to aura and photophobia. 5. Knowledge deficit regarding trigger management. Medical management. 1. Acute treatment: A. Analgesics, paracetamol, NSAIDs. B. Triptans, sumatriptans, rizatriptan. C. Anti-nausea medications: metoclopramide. 2. Preventive treatment: A. Beta blockers, propranolol. B. Antidepressants. C. Antiepileptics. D. CGRP inhibitors. Nursing management: 1. Acute episode care: A. Provide dark, quiet environment. B. Administer prescribed medication promptly. C. Monitor vital signs and pain level. 2. Education: Teach trigger identification and avoidance. B. Discuss the importance of medication adherence. 3. Lifestyle counseling: Encourage regular sleep and exercise routines. B. Advice on stress management techniques. 4. Supportive care: A. Provide emotional support to reduce anxiety. B. Refer to support groups if needed. Treatment: 1. Pharmacological: Acute and preventive medications as discussed above. 2. Non-pharmacological: Cognitive behavioral therapy CBT, biofeedback therapy, acupuncture. 3. Lifestyle modifications: Regular meals, hydration and avoiding triggers, relaxation techniques like yoga and meditation. Psychosocial medicine: 1. Addressing comorbidities, manage depression or anxiety that exacerbate migraines. 2. Support groups: Promote peer interactions to reduce isolation. 3. Counseling: Provide psychological therapy for coping mechanisms. Prevention: 1. Trigger avoidance, Maintain a headache diary to identify and avoid triggers. 2. Dietary adjustment. Limit caffeine, processed foods, and alcohol. 3. Regular exercise. Reduce stress and improves overall health. 4. Adequate sleep. Maintain a consistent sleep schedule. 5. Stress management. Practice relaxation techniques and mindfulness. In conclusion, migraine is a complex neurological condition requiring a multidisciplinary approach. Early diagnosis, effective treatment, and proactive lifestyle management can significantly reduce the frequency and severity of migraine attacks, improving the quality of life for affected individuals. Thank you. Have a nice day.